Hey there. If you're helping an older adult with their healthcare, you know this time of year brings a really big and, let's be honest, kind of overwhelming task: Medicare Open Enrollment. So in this explainer, we're going to break it all down into a clear, simple plan so you can help them get the best coverage and, save some money next year.
All right, let's just get right to it with the big question. It is so easy to get buried in all the mail and the confusing jargon. I get it. But this annual window, it is your single best chance to make sure your loved one isn't overpaying and that their plan actually covers what they need.
So you might be thinking, why can't we just stick with last year's plan? It worked fine. Well, that's probably the biggest mistake you can make. Medicare plans are absolutely not a set-it-and-forget-it kind of deal.
And this right here is the absolute crux of it. These plans can, and they often do, change everything from their costs to their coverage to their doctor networks every single year. Just sticking with the same plan without checking is a total roll of the dice.
And believe me, the impact of these changes can be huge. I mean, think about it. That low premium you liked, it could suddenly shoot up. That doctor they trust, they could suddenly be out of network. And maybe, worst of all, a critical medication that was covered this year might just not be on the list for next year. Any one of those things could lead to thousands of dollars in surprise costs.
So how do you even find out about all these changes? Well, your first clue is a letter called the ANOC, which stands for Annual Notice of Change. The plans have to send this out in September or October. It is basically your roadmap to everything that's going to be different. So keep an eye out for it in the mail.
Okay, so we know the problem. Now, what's the solution? To make this whole process way less intimidating, we're going to tackle this with a super simple 4-point checklist for reviewing any plan.
Here we go. It's just 4 things to focus on: premiums, deductibles and copays, prescriptions, and the provider network. That's it. If you can focus on just these 4 areas, you can really compare plans and feel confident about your decision.
Let's start with the easy stuff, the core costs. First, just look at the new monthly premium. Is it jumping up? Then, check the deductibles and copays. Are those going up too? Just answering those basic questions will tell you right away if it's even worth shopping around for something cheaper. Now, for what is honestly the most critical part of this whole review, the prescription drugs. I know this step takes a little time, but paying close attention right here is where you can find some major savings and avoid a world of frustration later. Okay, so you're going to hear this word a lot: formulary. It sounds complicated, but it's not. It's just the official list of drugs that a plan will cover. If a medication isn't on that list, you're paying 100% out of pocket. And even if it is still on the list, it might have moved to a more expensive pricing tier, which means your copay goes up.
So this is key. You have to go through this little checklist for every single medication your loved one takes. First, is it even on the new formulary? Second, what pricing tier is it in now? Third, is their local pharmacy still in the network? And finally, are there any new rules, like something called prior authorization, that could cause delays?
All right, last but definitely not least, the provider network. This is especially crucial for Medicare Advantage plans. Think of them like HMOs or PPOs. Now, don't just trust the plan's website directory. Those can be out of date. The absolute best way to know for sure is to just call the doctor's office or hospital and ask them directly, "Hey, will you be in network for this specific plan next year?" Look, if your head is spinning right now, that is totally normal. This is a lot. But the great news is you are not in this alone. There are some fantastic, totally free, and unbiased resources out there just waiting to help you.
The official Medicare website and their helpline are great places to start, but let me tell you about a real game changer. It's called SHIP. That's the State Health Insurance Assistance Programs. They give you free, one-on-one counseling with government-funded experts. They're not trying to sell you anything, so their advice is completely unbiased. It is an amazing resource.
Okay, so you know what to check, and you know where to get help. Now for the final and most important piece, the deadline, and what you need to do next.
Go ahead and mark your calendars. The open enrollment window is from October 15th to December 7th. Any changes you make during that time will kick in on January 1st. But listen, once December 7th passes, that's it. The door is shut until next year, so you really have to act during this window.
And remember, this isn't just about filling out paperwork. Think of this as an investment. A little bit of time you spend now can literally translate into better care, way lower costs, and honestly, just a lot less stress for you and your loved one for the entire year ahead.
So a few hours of work now for a full year of peace of mind.
What's your first step going to be? Are you going to hunt down that ANOC letter, or maybe make a list of all the prescriptions, or just schedule that call with the ship counselor? Taking that one small step today puts you back in the driver's seat.
And that's all for this explainer. We really hope this helped. Taking the time to check out your options now can just make a world of difference. Thanks for watching.